Picture this. You are at your grandchild's birthday party, surrounded by family and friends. Someone tells a particularly funny joke, and everyone bursts into laughter. You find yourself laughing so hard that tears come to your eyes. But then you notice something else has happened too, a small leak. Your heart sinks for just a moment, and you excuse yourself quietly to the restroom, hoping no one noticed. If this scenario sounds familiar, you are absolutely not alone. In fact, you are part of a remarkably large community of women who experience what medical professionals call stress incontinence. According to the National Institute on Aging, nearly 1 in 3 women over the age of 55 experiences some form of bladder leakage, particularly when laughing, coughing, sneezing, or engaging in physical activity. What many women do not realize is that this common experience is not something you simply have to accept as an inevitable part of aging. While changes in our bodies are natural as we mature, there are numerous effective ways to understand, manage, and often significantly improve bladder control. More importantly, experiencing occasional leaks does not reflect anything negative about your health, your femininity, or your worth as a person. Today, we are going to have an honest, respectful conversation about stress incontinence, what it is, why it happens more frequently as we age, and most importantly, what you can do about it. We will explore practical solutions, lifestyle adjustments, and medical options that can help you feel more confident and comfortable in your daily life. This is not a topic to feel embarrassed about. It is simply another aspect of health that deserves attention, understanding, and care. To better understand stress incontinence, let us first explore what happens in a healthy bladder system. Your bladder is like a balloon that stores urine until you are ready to empty it. This balloon sits in your pelvis, supported by a group of muscles called the pelvic floor. These muscles work together with your bladder muscles and urethral sphincter, the ring of muscle around the tube that carries urine out of your body, to give you control over when and where you urinate. When everything is working smoothly, your pelvic floor muscles and urethral sphincter remain strong enough to keep urine in your bladder, even when pressure increases from activities like laughing, coughing, or lifting something heavy. However, as we age, several natural changes can affect this delicate system. The Mayo Clinic explains that stress incontinence occurs when the muscles and tissues that support your bladder and control urination become weakened. When these support structures are not as strong as they once were. Physical activities that increase pressure on your bladder can cause small amounts of urine to leak out involuntarily. It is important to understand that stress incontinence is different from urge incontinence, which involves a sudden intense urge to urinate followed by involuntary loss of urine. Stress incontinence specifically happens during physical stress on the bladder, hence the name. This might occur when you laugh heartily, cough forcefully, sneeze, exercise, lift heavy objects, or even during intimate moments with your partner. The NHS notes that this condition affects women much more frequently than men, primarily due to anatomical differences and the unique experiences women have throughout their lives, particularly pregnancy and childbirth. However, it is crucial to remember that not all women who have had children experience stress incontinence, and some women who have never been pregnant do experience it. Understanding why stress incontinence becomes more common as we mature can help remove feelings of confusion or self-blame. According to Harvard Health Publishing, several natural age-related changes contribute to this increased likelihood. First, let us talk about hormonal changes. As women approach and go through menopause, estrogen levels naturally decline. Estrogen plays an important role in maintaining the strength and flexibility of tissues throughout your body, including those in your pelvic area. The tissues that support your bladder and urethra can become thinner and less elastic when estrogen levels drop, making them less effective at preventing leaks during moments of increased abdominal pressure. Your pelvic floor muscles, which have been working faithfully for decades, may also naturally lose some of their strength and tone over time. Think of these muscles like any other muscles in your body. Without specific attention and exercise, they can become weaker with age. This is completely normal and does not reflect any failure on your part to take care of yourself. Additionally, the bladder itself may undergo changes. The bladder muscle may become less flexible, meaning it cannot stretch as easily to accommodate urine. The capacity of your bladder may also decrease slightly, and the sensation of needing to urinate may become more urgent or less predictable. WebMD points out that other factors can also contribute to stress incontinence as we age. Chronic cough from conditions like asthma or bronchitis puts repeated pressure on the pelvic floor. Constipation, which becomes more common with age, can also strain these muscles. Even certain medications commonly prescribed to older adults can affect bladder function. Weight changes can also play a role. Additional weight around the midsection can put extra pressure on the bladder and pelvic organs. However, it is important to note that women of all body types can experience stress incontinence. It is not limited to any particular size or shape. Previous surgeries, particularly hysterectomies or other pelvic surgeries, may also affect the support structures around your bladder. Again, this does not mean that having surgery was wrong or that you should have done anything differently. It simply means that your body may need additional support now. Many women initially dismiss occasional leaks as insignificant or temporary. While it is true that a single incident here and there may not be cause for concern, recognizing patterns can help you understand when it might be time to take action. The National Institute of Diabetes and Digestive and Kidney Diseases describes several common signs of stress incontinence. You might notice small amounts of urine leaking when you laugh hard at a funny movie or joke. Coughing fits during cold season might result in unexpected dampness. Sneezing, particularly those sudden, forceful sneezes that catch you off guard, might cause brief leaks. Physical activities can also trigger stress incontinence. This might happen when you are lifting groceries, moving furniture, gardening, or exercising. Some women notice leaks when they stand up quickly from a seated position or when they are walking upstairs. Even activities as gentle as yoga or stretching might occasionally result in small leaks. It is important to pay attention to how these incidents make you feel emotionally. Are you starting to avoid certain activities because you worry about leaks? Do you find yourself mapping out restroom locations whenever you go somewhere new? Are you limiting your fluid intake in social situations? Have you stopped exercising or participating in activities you used to enjoy? If you are answering yes to these questions, it may be time to take a more proactive approach. The goal is not to eliminate every single leak. That may not be realistic or necessary, but rather to regain confidence and comfort in your daily activities. Keep in mind that stress incontinence can range from very mild, perhaps a few drops during a particularly hearty laugh, to more significant, where you might need to change undergarments or clothing. There is no threshold of severity that makes your experience more or less valid. If it bothers you or affects your quality of life, it deserves attention. The encouraging news is that many women find significant improvement through simple lifestyle adjustments. These changes do not require dramatic overhauls of your daily routine, but rather small, sustainable modifications that can have meaningful impacts. Let us start with fluid management. While it might seem logical to drink less to reduce leaks, this approach can actually backfire. According to the Mayo Clinic, reducing fluid intake too drastically can lead to dehydration and can make your urine more concentrated, which can actually irritate your bladder and make symptoms worse. Instead, focus on smart hydration strategies. Try spreading your fluid intake throughout the day rather than drinking large amounts at once. Consider reducing or eliminating bladder irritants such as caffeine, alcohol, carbonated beverages, and acidic drinks like citrus juices. You do not necessarily need to give these up entirely, but notice if there is a connection between consuming them and experiencing more leaks. Timing can also matter. If you know you will be in a situation where using the restroom might be challenging, like a long car trip or important meeting, you might choose to moderate your fluid intake beforehand. However, always maintain adequate hydration for your overall health. Weight management, while not always easy, can sometimes help reduce pressure on your pelvic organs. If you are carrying extra weight, even a modest reduction of 5 to 10 pounds might make a noticeable difference. Focus on healthy, sustainable approaches rather than dramatic diets. Walking, swimming, and other gentle exercises can support both weight management and overall pelvic health. Speaking of exercise, Regular physical activity can actually help with stress incontinence, despite what you might fear. Low-impact activities like walking, swimming, cycling, and yoga can strengthen your core muscles without putting excessive pressure on your pelvic floor. High-impact activities like running or jumping might need to be modified, but this does not mean you need to become sedentary. Managing constipation is another important lifestyle factor. Chronic straining during bowel movements can weaken your pelvic floor muscles over time. Increase fiber in your diet through fruits, vegetables, and whole grains. Stay hydrated and consider gentle physical activity to support regular bowel movements. If constipation persists, speak with your healthcare provider about safe options for your situation. One of the most effective tools for managing stress incontinence is something you can do anywhere, anytime, without any special equipment. Pelvic floor exercises, often called Kegel exercises after the doctor who popularized them, can significantly strengthen the muscles that support your bladder. The NHS describes the pelvic floor as a hammock of muscles that stretches from your pubic bone to your tailbone, supporting your bladder, uterus, and bowel. Like any muscles, these can be strengthened with regular, proper exercise. Learning to identify your pelvic floor muscles is the first step. One way to find these muscles is to imagine stopping the flow of urine midstream. The muscles you would squeeze to do this are your pelvic floor muscles. Another way is to imagine preventing gas from escaping. Again, the muscles you would tighten are part of your pelvic floor. You can also insert a clean finger into your vagina and squeeze. You should feel the muscles tightening around your finger. Once you have identified these muscles, you can begin exercising them. Start by squeezing your pelvic floor muscles for 3 seconds, then relaxing for 3 seconds. Repeat this 10 times. As you get stronger, you can gradually increase the hold time to up to 10 seconds, with 10 seconds of rest between each squeeze. Try to do this exercise 3 times per day, perhaps once in the morning, once in the afternoon, and once in the evening. The beauty of pelvic floor exercises is that you can do them anywhere, while watching television, sitting at your computer, waiting in line at the grocery store, or lying in bed. It is important to exercise these muscles correctly. Avoid holding your breath and do not squeeze your buttocks, thigh muscles, or abdominal muscles at the same time. Focus specifically on the pelvic floor muscles. Also, remember not to do these exercises while urinating, as this can actually interfere with complete bladder emptying. WebMD notes that it may take several weeks or even months to notice improvement from pelvic floor exercises. This is completely normal. These muscles, like any others, need time to build strength. Do not get discouraged if you do not see immediate results. Consistency is more important than intensity. If you are having trouble identifying or exercising these muscles correctly, consider working with a pelvic floor physical therapist. These specialized professionals can provide personalized guidance and ensure you are performing the exercises effectively. While working on strengthening your pelvic floor muscles and making lifestyle adjustments, you may also want to consider products that can provide additional security and comfort in your daily life. Modern incontinence products have come a long way from the bulky, uncomfortable options of the past. Today's products are designed to be discreet, comfortable, and effective. The key is finding what works best for your specific needs and lifestyle. For light leakage, panty liners or light incontinence pads can provide protection without bulk. These are designed specifically for urine, unlike menstrual products, so they are more effective at controlling odor and wetness. Many brands offer ultra-thin options that are virtually undetectable under clothing. For more significant leakage, there are more absorbent pads available. These come in various sizes and absorbency levels. Some have adhesive strips to keep them securely in place, while others are designed to be held in place by snug-fitting underwear. Protective underwear is another option. These look and feel more like regular underwear, but have built-in absorbency. They can be particularly helpful for active women or those who experience unpredictable leaks. When choosing products, consider your activity level, the amount of protection you need, and your comfort preferences. You might find that different products work better for different situations, perhaps lighter protection for everyday activities and more absorbent options for exercise or long outings. Some women find that using a small amount of barrier cream in their intimate area can help prevent irritation from frequent pad use. Look for products specifically designed for sensitive skin, and avoid those with heavy fragrances or harsh chemicals. Remember that using these products is not a sign of defeat or resignation. They are simply tools that can help you feel more confident and comfortable while you work on other management strategies. If you are finding this information helpful and reassuring, please take a moment to like this video and subscribe to our channel. We are committed to providing respectful, medically sound information about health topics that matter to women like you. Hit that notification bell so you will not miss our upcoming videos about aging gracefully and maintaining your health and confidence at every stage of life. While many cases of mild stress incontinence can be effectively managed with the strategies we have discussed, there are times when professional medical help can make a significant difference. Knowing when to reach out is an important part of taking care of yourself. Consider speaking with your healthcare provider if your stress incontinence is affecting your quality of life. This might mean you are avoiding activities you enjoy, feeling anxious about social situations, or finding that the strategies you have tried are not providing sufficient relief. Also consult with a medical professional if you notice changes in your symptoms, if leaks become more frequent or more severe, if you develop burning or pain with urination, if you notice blood in your urine, or if you begin experiencing strong urges to urinate in addition to stress leaks. These could indicate other conditions that need attention. The National Institute on Aging emphasizes that you should never feel embarrassed about discussing incontinence with your doctor. Healthcare providers are trained to address these concerns with sensitivity and professionalism. They have seen it all, and they understand that this is a common, treatable condition. Your healthcare provider will likely start with a thorough medical history and physical examination. They may ask about your symptoms when they occur and how they affect your life. They might also inquire about your medical history, medications, and lifestyle factors. Keeping a bladder diary for a few days before your appointment can be helpful. Note when you urinate, when you experience leaks, what you were doing at the time, and how much fluid you are consuming. This information can help your provider better understand your specific situation. Depending on your symptoms and medical history, your provider might recommend additional tests. These could include a urinalysis to check for infection or other abnormalities, or specialized tests to evaluate how well your bladder and pelvic muscles are functioning. Treatment options your healthcare provider might discuss include prescription medications that can help strengthen bladder control, medical devices like pessaries that can provide additional support to your pelvic organs, or in some cases, minor surgical procedures that can improve the support structures around your bladder. The important thing to remember is that you have options. Stress incontinence is a medical condition with multiple effective treatments, not a character flaw or something you simply have to endure. If lifestyle modifications and pelvic floor exercises do not provide sufficient improvement, various medical treatments can be highly effective for stress incontinence. Understanding these options can help you have informed discussions with your healthcare provider. Medications are one possibility, though they are less commonly used for stress incontinence than for other types of bladder control issues. However, the Mayo Clinic notes that certain medications can sometimes help strengthen the muscles around the urethra or improve nerve signals that control bladder function. Pessaries are small, removable devices that are inserted into the vagina to provide additional support to the bladder and urethra. They come in various shapes and sizes, and your healthcare provider can help determine if this option might be appropriate for you. Many women find pessaries comfortable and effective, and they can be removed and cleaned regularly. For women who do not find sufficient relief from conservative treatments, surgical options are available. These procedures are typically minimally invasive and have high success rates. One common approach involves placing a small mesh sling under the urethra to provide additional support. Another option involves injecting bulking agents around the urethra to help it close more effectively. It is important to understand that surgery is not necessarily the first or best option for everyone. Your healthcare provider will consider factors such as your overall health, the severity of your symptoms, your lifestyle, and your personal preferences when discussing treatment options. WebMD emphasizes that the goal of any treatment is to improve your quality of life and help you feel more confident and comfortable. The best treatment is the one that achieves this goal with the least risk and disruption to your life. Before considering any medical treatment, make sure you understand the benefits, risks, and expected outcomes. Ask about the recovery process, potential side effects, and what you can expect in terms of improvement. Do not hesitate to seek a second opinion if you have concerns or questions about recommended treatments. Beyond medical treatments and formal exercises, there are numerous practical strategies that can help you manage stress incontinence day to day while maintaining your confidence and dignity. Timing your bathroom visits can be surprisingly helpful. Rather than waiting until you feel a strong urge to urinate, try using the restroom on a regular schedule, perhaps every 2 to 3 hours during the day. This can help ensure your bladder does not become overly full, which can increase the likelihood of leaks. Before engaging in activities that typically trigger leaks for you, like laughing at a comedy show or doing yard work, consider using the restroom first. This simple step can often prevent or minimize incidents. Clothing choices can also impact your comfort and confidence. Well-fitting, supportive undergarments can provide gentle compression that may help with bladder support. Avoid clothing that is too tight around your waist or abdomen, as this can increase pressure on your bladder. Consider the colors and fabrics you choose for your outer clothing. Darker colors and busy patterns can help camouflage any potential accidents, while lighter colors and thin fabrics might make you feel more self-conscious. Choose clothing that makes you feel confident and comfortable. When you are out and about, familiarize yourself with restroom locations. This is not about living in fear or limiting your activities, but rather about practical planning that can help you feel more secure. Many smartphone apps can help you locate nearby public restrooms. For exercise and physical activities, consider double protection, perhaps a light incontinence pad, along with supportive exercise clothing. Some women find that crossing their legs or contracting their pelvic floor muscles before coughing or sneezing can help prevent leaks. Remember that managing stress incontinence is often about finding the right combination of strategies that work for your specific situation. What works perfectly for one woman might not be the best approach for another, and that is completely normal. It is important to acknowledge that stress incontinence can affect more than just your physical comfort. It can also impact your emotional well-being and self-confidence. These feelings are completely valid and understandable. Many women report feeling embarrassed, frustrated, or even ashamed about bladder leaks. You might find yourself becoming more self-conscious in social situations or avoiding activities you previously enjoyed. These reactions are normal, but they do not have to become permanent parts of your life. Harvard Health Publishing notes that the emotional impact of incontinence is often underestimated. Women may begin to see themselves differently, perhaps feeling less attractive, less capable, or less feminine. It is crucial to recognize that experiencing bladder leaks does not change who you are as a person or diminish your value in any way. One helpful approach is to reframe how you think about this condition. Rather than seeing it as a personal failing or inevitable decline, try to view it as a common health condition that can be managed effectively. You would not blame yourself for needing glasses to see clearly or taking medication for blood pressure. Stress incontinence is simply another health matter that deserves attention and care. Staying connected with friends and family is important for your overall well-being. If you find yourself withdrawing from social activities, consider whether there are ways to modify rather than eliminate these interactions. Perhaps you choose restaurants with easily accessible restrooms, or you arrive early to events so you can locate facilities without feeling rushed. Some women find it helpful to confide in a trusted friend or family member about their experiences. You may be surprised to discover that many women in your circle have dealt with similar issues. Sharing your experience can reduce feelings of isolation and provide practical tips from others who understand what you are going through. Support groups, either in person or online, can also be valuable resources. Connecting with other women who share similar experiences can provide both emotional support and practical advice. Many women report feeling relieved to discover they are not alone in dealing with these challenges. Professional counseling can also be beneficial if you find that stress incontinence is significantly affecting your mood, self-esteem, or quality of life. A counselor who understands health-related challenges can help you develop coping strategies and work through any feelings of anxiety or depression that may have developed. Remember that seeking help for the emotional aspects of stress incontinence is just as important as addressing the physical symptoms. Your mental and emotional well-being deserve the same care and attention as your physical health. Creating a strong support network can make a tremendous difference in how you experience and manage stress incontinence. This network might include healthcare professionals, family members, friends, and other women who understand what you are going through. Start with your healthcare team. In addition to your primary care provider, you might benefit from working with specialists such as urologists, gynecologists, or pelvic floor physical therapists. These professionals can provide specialized knowledge and treatment options tailored to your specific needs. Do not underestimate the value of your pharmacist as a resource. Pharmacists can provide information about over-the-counter products, help you understand any medications you might be prescribed, and answer questions about drug interactions or side effects. Family members and close friends can be important sources of emotional support, but they may not always know how to help unless you guide them. Consider sharing information about your condition and what kinds of support would be most helpful to you. This might mean having someone accompany you to medical appointments, helping with research about treatment options, or simply being understanding if you need to make accommodation for restroom breaks during activities. Online communities can also provide valuable support and information. Many reputable health websites host forums where women share experiences, tips, and encouragement related to bladder health. However, remember to verify any medical information you receive online with qualified healthcare professionals. Local support groups may be available through hospitals, community centers, or organizations focused on women's health. These groups can provide face-to-face interaction with others who understand your experiences. Professional organizations such as the National Association for Continence provide educational resources and can help you locate healthcare providers who specialize in treating incontinence. These organizations also work to reduce stigma and increase awareness about bladder health issues. Remember that building a support network takes time, and you may need to try different resources to find what works best for you. Some women prefer more private approaches, while others benefit from more social support. There is no right or wrong way to seek help. The important thing is finding the support that makes you feel more confident and empowered. As we near the end of our conversation, it is important to emphasize that stress incontinence does not have to define or limit your life. While it may require some adjustments and management strategies, it should not prevent you from living fully and engaging in the activities that bring you joy and fulfillment. Many women find that once they develop effective management strategies, stress incontinence becomes a minor inconvenience rather than a major life disruption. With the right combination of lifestyle modifications, exercises, products, and possibly medical treatment, most women can achieve significant improvement in their symptoms and confidence. Remember that managing stress incontinence is often an ongoing process rather than a one-time fix. Your needs may change over time, and strategies that work well now might need to be adjusted in the future. This is normal and does not mean you are failing in your management efforts. Stay informed about new developments in treatment options. Research in this area continues to advance, and new products and treatment approaches are regularly becoming available. Your healthcare provider can keep you updated on options that might be relevant to your situation. Continue to prioritize your overall health and well-being. Regular exercise, a balanced diet, adequate sleep, stress management, and regular medical checkups all contribute to your overall health and can impact your bladder health as well. Do not let fear of potential leaks prevent you from trying new activities or pursuing interests that excite you. With proper preparation and management strategies, you can continue to travel, exercise, socialize, and engage in hobbies and volunteer work. You might need to make some accommodations, but this should not mean giving up on experiences that enrich your life. Keep advocating for yourself in healthcare settings. If a treatment is not working well for you, speak up. If you feel your concerns are not being taken seriously, seek another opinion. You know your body and your experience better than anyone else, and you deserve healthcare providers who listen and respond to your needs. Finally, remember to celebrate your successes, no matter how small they might seem. If you manage to get through a social event without worrying about leaks, if you complete an exercise routine that you thought might be problematic, or if you have a day where you feel completely confident and comfortable, acknowledge these victories. They are evidence of your resilience and your ability to adapt and thrive. Stress incontinence is a common experience for many women over 55, but it does not have to be a source of ongoing distress or limitation. With understanding, appropriate management strategies, and professional support when needed, most women can achieve significant improvement in both their symptoms and their quality of life. The key messages to remember are these. You are not alone in this experience. It is not your fault, and it does not reflect any personal shortcoming. There are effective strategies and treatments available. You deserve to feel comfortable and confident in your body at every age. Take pride in taking steps to understand and address this condition. Whether that means starting pelvic floor exercises, making lifestyle adjustments, using supportive products, or seeking medical care, you are taking positive action to improve your health and well-being. Remember that aging is a privilege that not everyone gets to experience, and every stage of life brings both challenges and opportunities. Stress incontinence may be one challenge you face, but it is just one aspect of your health, not a definition of who you are or what you are capable of achieving. You have lived a full life, accumulated wisdom and experience, and developed resilience through previous challenges. These same qualities that have served you well in other areas of your life will help you successfully manage stress incontinence as well. Your body has served you faithfully for many years, and it deserves your patience, care, and respect as it continues to age. Treating stress incontinence with the same matter-of-fact approach you would use for any other health condition, with appropriate care, professional guidance when needed, and self-compassion, is the healthiest approach for both your physical and emotional well-being. If this message has helped you feel more informed, empowered, or simply less alone in dealing with stress incontinence, please consider subscribing to our channel and sharing this video with other women who might benefit from this information. Together, we can reduce the stigma around these common health concerns and help more women feel confident about seeking the care and support they deserve. Remember, you deserve to feel clean, healthy, comfortable, and proud of your body at any age. Taking care of your bladder health is just another way of taking care of yourself, and you are absolutely worth that care and attention. Thank you for joining me for this important conversation. Here is to your continued health, confidence, and well-being.